Welcome back to another podcast powered by ALTUS Chiro and Physio. I have the wonderful Dr. Trang Luu Grover here with me.
Hi.
Hey, we're going to talk about something cool and very ninja. And it's a topic called Instrument Assisted Soft Tissue Mobilization. Acronym is IASTM. So what is Instrument Assisted Soft Tissue Mobilization?
Yeah, so instrument assisted soft tissue mobilization, also known as IASTM, is a technique that involves using a set of handheld instrument that's used to scrape or apply gentle pressure to the individual's muscles, ligaments, tendon, nerves, and fascia. And here in the office, we do offer this specific technique. A few of our practitioners are trained in the office, including myself, to use this technique. And so I have a few here that I can show to the audience.
You see why I now call it ninja? It's like,
very intimidating looking, eh?
Holding these tools.
It actually originated or evolved from a traditional Chinese medicine method called gua shuo. And so gua shuo, the instrument is slightly different. The edges are a little bit smoother, but similar method where it is applied to the area, sort of the area that's painful. So the instrument looked different, but also the rationale and the goal behind why they're being used is also different as well.
So Trey, what does it do? What does IASTM actually do?
That's a really good question. So IASTM is used to break down scar tissue and fascial restrictions in the soft tissue, as I mentioned, the muscle, tendon, joints, nerves, and the fascia itself. And this helps to allow faster pain relief and improve mobility and quicker rehabilitation and recovery.
How is it applied? Just on certain parts that have additional scarring?
I'll demonstrate it on myself. So you can use it anywhere in the body. Forearm, I'll use as an example, just because it's easy. You can see it there.
That's right.
So these instruments here, I only grabbed two. We've got a set of them. So depending on where you're working on, if it's a bigger group of muscles, such as the quads, the glutes, then we use the instrument that's a little bit bigger. So this one is probably best for somewhere like your forearm. So first, I use a little bit of application. So you can use lotion. We've got some P3 here, just so that when you're applying it, it's comfortable for the patient. And then when you're applying it, it gives it a nice, smooth glide.
Correct.
So apply a little bit. And then I like to check in on the patient. So you apply for about 30 seconds. It'll create a little bit of a red response. You can't really see it there, but so maybe if I move a little bit closer. So you do get a little bit of red response, and we want it to change in color because we want to create a little bit of inflammation to the area, and that helps to promote the healing and the recovery process. And so 30 seconds or so, I check in. You don't want it to be like a dark red color, just a little bit of pink color, and we call it petechiae.
What do you call that again?
Petechiae. It's just a medical term that when you're scraping on the area, it creates a little bit of an inflammatory response to the area. Yeah.
I love this one because this looks like a ninja tool. And then the other one I have in mind is it's like a butter knife. The other one's like the butter knife.
Oh, yeah. So this one, edges are all quite unique. Like this one has a little bit.
Beard shaving tool.
Yeah, totally. So this one, you can use it on this edge and then this part here, depending on sort of which area you're working on, like this one, back to this one, the smaller pointy end, you can use it for hands. So smaller areas to really get into those areas that the scar tissues are hiding underneath. So,
okay. Trang, when would this technique be used?
When would it be used?
Yeah, when would somebody want this technique?
Yeah, so for most of our patients, as I mentioned already, excessive scar tissue, anywhere where there's tendinitis, tendinopathy, Achilles tendinitis, which is more down towards your ankles. You can use it anywhere in the body. Common one that I find and I get a lot of really good results from is tennis elbow and golfer's elbow. So what I was doing there on the elbow, we've got tennis elbow, and then golfer elbow will focus more on the inside part. And then a lot of runners that come in with IT band pain. So IT band runs along the side of your leg. And so because of that repetitive movement that these individuals do every day, it creates a sort of micro injury to the area. And so things such as those type of condition would be appropriate for IASTM to be used.
Okay, that's great.
Mhm.
Now, can anyone call in and request for this kind of treatment type?
Yeah, so absolutely. Anyone can call in and request for this type of technique. So what we do here in the office is we book everyone for an initial assessment first, and then the practitioner would then sort of evaluate and see if this person is a good candidate for a specific technique like this. And if we recognize that the individual is not going to benefit from ISTM, then the practitioner would then give alternatives or provide maybe a different option for the patient or refer them out to a different healthcare provider. Yes, you can, but we would have to go through the assessment first to make sure that you're a good candidate.
Hey, I'm just very curious, Trang. How would
Yeah.
you compare, in your own personal experience,
Mhm.
IASTM versus, let's say, Shockwave?
Okay. So personally, I would say that based on my experience, shockwave therapy, I find it really beneficial for chronic type of conditions. And so I've seen that people tend to respond better. For example, plantar fasciitis. And so certain conditions do respond better with certain therapies based on my experience. So for ISTM, tennis elbow, golfer's elbow, very effective. And even like those chronic tension, upper back tension, or neck tension, chronic headaches, I find ISTM really beneficial. And then for shockwave therapy, plantar fasciitis is what I found is very beneficial. So they're both really good, and it just depends on the condition.
If you could relay one client's story with you
Mhm.
using IASTM on them, what was their situation? What was their recovery like, or the journey of treatment like?
Mhm.
Without mentioning names, of course.
Oh, okay. So use a tennis elbow, for example, because I see a lot of that. So a patient comes in and they've got tennis elbow. I would say based on my experience, so the technique itself, not just using the instrument to scrape the area, but we also give follow-up exercises for the patient to do at home. So if they are not complying to the recommendations that we're giving to them at home, it really doesn't make it that beneficial. So there are exercises that we give for patients to do at home. So he was suffering from tennis elbow for like years. And
Wow.
so we were able to get him better. I think it was like 8 to 12 visits, and they're weeks apart. They're not like
Mhm.
every day he comes in. So we start him off with 2 days a week coming in for the treatment. And so that would be 2 days a week for 4 weeks. And that's a total of 8 weeks. After that, I reassess where he's at. And I think it was about 1 to 2 months, roughly 8 to 12 visits that he was able to get back to doing what he likes without having to feel any pain or discomfort. And so that's one case I can think of right now. And then, of course, those exercises that he would have to do at home to continue with it. And then every once in a while, if he gets a bit of a flare up, then we'll come in and book an appointment once every few months, or when he feels like, okay, maybe it's a heavy lifting day. He's an athlete, heavy lifting day or heavy lifting week, then he'll come in a little bit sooner.
That's great. It's good to know, because I was going to ask you if he was a tennis player or whether, but you just mentioned he's in the gym.
Lift,
Probably
I
like a
guess
power
that
lifter.
power lifter, yes.
Yeah.
Not professionally, but he does it.
So what you're saying is, if we're bad students and don't do our homework, the pain will prolong.
Pretty much, yeah. So I
Yeah.
think from at least how I practice, and I know other chiropractors, they might practice differently, but here in our office, we want to make sure the patients, like our goal is obviously to get the patient better, but we want them to be independent and proactive about their health. Don't wait for things to break down for you to do something about it, right? So we want to encourage people to, if you're already feeling good, you maintain feeling good, you maintain the strength and stay strong. So that's our philosophy here.
That's great. That's great. For those that do not know Trang and wonder why at times during this podcast, she almost sounded like she's out of breath. It's because she is expecting. And this is her final episode before she delivers a baby. So she'll be a different and whole new, brand new woman
That's right.
next time you see her on the podcast. Congratulations.
Thank you so much. Thanks for your time.
Thanks, folks, for tuning in to today's podcast with Dr. Trang Luu. And we spoke about IASTM. Stay tuned for next week's episode as we cover more chiropractic and physiotherapy topics with ALTUS Chiropractic and Physiotherapy.
Thank you.